new at 4, a recent study from researchers at Brown and Harvard universities had a startling finding. Avoidable deaths rose across the U.S. for more than a decade, in contrast with most other high-income nations. On average, these deaths rose in all 50 states, including right here in New England. Boston Globe, Rhode Island reporter Christopher Gavin wrote about what researchers learned. Chris, thanks for being here.
Thank you, Kim. Glad to be here.
So when we say avoidable deaths, what exactly are we talking about here?
Well, these deaths are what you may expect them to be. They range from motor vehicle crashes to drug-related deaths and suicides. They can also include deaths that could have been prevented by vaccines, medicine, or medical treatment of some kind, according to the researchers. Now, notably, the research shows deaths from a variety of different causes are on the rise, with the exception of cancer in some states.
All right, it's pretty bleak, but what is the big takeaway from these findings?
Yeah, so the research published in JAMA Internal Medicine shows that between 2009 and 2021, avoidable mortality worsened in the United States on average by 32.5 avoidable deaths per 100,000 people. During that same time period, the rate actually decreased in 40 high-income countries in the European Union by 25.2 avoidable deaths per 100,000 people, and dropped in the 38 member countries that make up the Organization for Economic Cooperation and Development by 22.8 deaths per 100,000 people. So researchers compared mortality data for people under the age of 75 for the study, which also found there was no clear link between how much states spend on health matters and avoidable mortality. So generally speaking, the researchers say avoidable mortality can be a more effective measure of a country's health system and public health policy than life expectancy, even if the deaths are not always entirely preventable.
The data always tells a story. So let's zoom in a little bit here. What does it say specifically about New England?
Yeah, so in reporting the story, my colleague Emily Spatz learned the region fared better than other parts of the country, but still saw an increase in avoidable deaths. So, Rhode Island experienced a jump from 234 to 296 deaths per 10,000 people, while Massachusetts actually had the lowest increase in avoidable deaths in the nation, going from about 204 to 256 deaths per 10,000 people. The Bay State was also among a select few states that saw a drop in treatable mortality or deaths avoided through effective health care.
Okay, so that's a lot of numbers, a lot of data. What do all of these findings suggest? What's the big takeaway?
So the researchers say their findings suggest persistent and ingrained issues within the American healthcare system and in public policy are driving factors behind worsening health outcomes. And it's worth mentioning the U.S.'s high healthcare spending, but poor outcomes spends a lot on healthcare, that is. But the poor outcomes could simply be the result of increasing costs of care. As for what can be done, that's what researchers are looking to dive into next.
And if you want to spend a little bit more time with this data and read a little bit more, you can find Chris's full story right now at globe.com/Rhode Island/RI, I should say. Christopher Gavin, thanks for being here.
Thank you, Kim.